Is it on? The next special tests are going to look at, the first one's going to look at labral integrity, called the Obrien's test. And with the Obrien's test, you want to have the patient in 90 degrees of flexion, about 15 degrees of horizontal adduction, and then full internal rotation and pronation, internal rotation at the shoulder, pronation at the forearm. Again, you can stabilize, and then what you want to do is resist this position and have the patient hold. A normal sign, a normal test would be no pain, no cracking, no crepitus, no popping in the area, kind of superior, anterior, labral area here. A positive test, again, would be what you're doing is you're kind of compressing the labrum here, and you're provoking that. So as they resist, it's kind of compressing. So if there's a tear, they'd have pain. They could have popping, cracking, crepitus, those sorts of signs or symptoms. The next test is looking at the long head of the biceps and looking at a tendinopathy. This can also elicit slap lesions. And with the speeds test, what you want to do is have the patient hold their arm with external rotation in supination at the forearm, and then they hold it there. Again, you can stabilize, and then you can resist at the wrist or palm and have them hold. And you're looking for pain where the long head of the biceps is or where the labrum is. And then the next thing you want to have them do is internally rotate and pronate, and then repeat the test, and typically this will make the symptoms better. All right, the next test is going to be the Obrien's test. With the Obrien's test, what you want to do is position the arm in 90 degrees of flexion, and then what you want to do is have 15 degrees of horizontal adduction, the shoulder and internal rotation, the forearm pronated, and then what you want to do is have the patient hold. A normal test, there's no pain, no crepitus, no popping in the area of the labrum. With a positive test, again, 15 degrees of horizontal adduction, full internal rotation pronation, and what they would do is they typically have a popping or pain with a positive test, or crepitus in the area of the labrum. So with this test, you're compressing the labrum, which may be torn. After that, if they do have a positive test, what you want to do is you want to keep them in that position of 15 degrees horizontal adduction, and then externally rotate and supinate their forearm and see if that decreases the pain. So if they have a labral tear, that may decrease the pain.